Welcome, everyone, to WombWise. This is episode 6. We're really glad you could join us today. We're going to be focusing on something that resonates with so many hopeful parents really navigating the whole IVF journey, specifically when you're starting your family after age 35. We know age can bring, well, its own unique set of challenges, sometimes complex medical needs, often combined with feeling like the clock is ticking louder. This exploration of the practical steps and the emotional side, too, is brought to you by Fertilope. They're based in Ahmedabad, India, which is actually a global hub for really top-notch affordable fertility care. Fertilope acts like your personal fertility concierge. Their whole mission is about making treatment less stressful and, frankly, less expensive. They help connect you with exactly the right doctor and clinic, especially for maybe more complex age-related situations. They handle all the appointment coordination, find comfortable long-stay places if you need them, and, importantly, offer emotional and wellness support, things like counseling, yoga. Fertilope really wants your focus to stay just on your health and your path forward.
And that focus is just so crucial because, as you said, the biological timeline, well, it shifts quite a bit once you cross that 35 threshold. It's just a reality many couples face, balancing careers, life goals, and then realizing biology has its own schedule. IVF isn't some last resort. For many, it's actually a very promising, very effective bridge. It offers a controlled, proactive way forward.
Okay, so let's get into the why behind that, the science of fertility after 35.
Let's start there. For women, it really boils down to egg quality and quantity. Just a biological fact, you're born with millions of eggs, but by puberty, that number has already dropped significantly, maybe to around 300,000 or 400,000. And the decline, it really speeds up after 30, and then even more noticeably after 35. It's not just fewer eggs, it's also that the remaining eggs have a higher chance of chromosomal issues. That's why naturally the chance of conception per cycle drops maybe down to 10 or 15%. And it also explains the increased risk of miscarriage we unfortunately see. Plus, the ovaries might just respond a bit slower to fertility medications.
That's a tough reality to hear, especially if you feel healthy, you exercise, you eat well.
Yeah.
It's hard to accept that biological quiet over how good you actually feel.
Oh, completely understandable.
Yeah.
But yes, you do have to respect that timeline. Being healthy is fantastic for overall well-being and improves your general health, but it doesn't fundamentally change the age of the eggs themselves.
Right. And we need to talk about the male partner, too. Men stay fertile longer, generally, but things still change. Sperm quality and motility, that's how well the sperm move, they can start to decline, especially after age 40. And something else that's really critical is the risk of DNA fragmentation in older sperm. Think of it like tiny breaks in the genetic code. This can directly impact the quality of the embryo that forms.
Yeah, which is why Fertilope often recommends this key first step if you're over 35 as a couple.
Yeah.
The very first thing you should probably invest in isn't necessarily a treatment cycle right away, but a really thorough fertility health check. Assess the egg reserve, check sperm quality, look at hormone levels first, get the full picture. Exactly, get that baseline. Because when you're 35 or older, time becomes a really critical factor. We often don't have the luxury of spending months or even years waiting for natural conception if there are underlying issues. Things like maybe diminished ovarian reserve or endometriosis or low sperm motility.
And that's precisely where IVF shifts from just being a treatment option to being a really smart, strategic tool. It offers that precision where natural attempts might struggle against those biological hurdles. I mean, think about it. IVF lets doctors stimulate multiple eggs in one go, kind of widening the possibilities. Then they can select the embryos that look the most promising, use advanced screening. It's about efficiency and control when time matters most.
Right. And because of these age-related factors we've discussed, the IVF journey for older couples needs to be highly customized. It really starts with that detailed consultation and testing phase. We look very closely at ovarian reserve markers, things like AMH, the anti-Müllerian hormone, which gives a sense of the remaining egg supply, and AFC, the antral follicle count, seen on ultrasound. We combine that with hormone profiles, detailed sperm analysis. This whole assessment is quite complex, and getting the right guidance here is key. Fertilope helps connect patients with specialists in Ahmedabad who really excel in managing these specific age-related cases.
Okay, so once that specific plan, that protocol is decided, then comes the ovarian stimulation phase. And because older ovaries might respond a bit more slowly, doctors often need to use potentially higher doses of hormones, which means monitoring needs to be incredibly close. We're talking frequent ultrasounds, blood tests, making adjustment almost in real time to keep things safe and effective.
Then comes the egg retrieval and the fertilization stage. Here, we very commonly use a technique called ICSI. That stands for intracytoplasmic sperm injection. Basically, we would take a single, healthy-looking sperm and inject it directly into the egg. This is especially helpful if there are male factor issues related to age or other causes. It really boosts fertilization rates significantly.
And then a step that becomes almost essential for couples over 35, genetic screening. This is PGTA, pre-implantation genetic testing for aneuploidy. Aneuploidy just means the embryo has the wrong number of chromosomes. Since older eggs have a higher risk of these errors, PGTA acts like a quality check. It helps screen out abnormal embryos before they're transferred. This can dramatically reduce the chance of miscarriage and hopefully shorten the time to a healthy pregnancy. And finding affordable, reliable options for PGTA is important. That's another area where Fertilope can help guide patients to optimize costs without skipping this crucial step.
Absolutely.
Yeah.
Then after the embryo transfer comes what many find the hardest part, the 2-week wait for the pregnancy test result. It's an incredibly charged emotional time, requires a lot of mental resilience. And this is where Fertilope's comprehensive support really comes in, connecting patients with wellness partners, offering yoga, stress relief sessions, just to help nurture calm during that wait.
Yeah, that emotional side for IVF over 35, it's unique. It's not just the standard anxiety about whether it will work. Many people talk about feeling this layer of regret maybe, or even guilt about waiting. And then you often have external pressures too from family or society. It's a lot to carry.
It is. And we see emotional wellness as absolutely integral to the whole process, not just some add-on. It really can impact success. That's why Fertilope puts such emphasis on things like counseling, connecting with others going through it. And they also introduced Garb Sanskar, which is this really beautiful ancient Indian philosophy focused on conscious conception, mindful preparation, and prenatal bonding. Practices like these help manage stress and foster a positive mindset.
That sounds incredibly supportive. To make this more real, maybe we can share a story. Let's talk about Neha and Arjun. They were a couple from Nairobi trying for about 12 years, and sadly they'd experienced 3 miscarriages. They eventually connected with Fertilope and sought treatment in Ahmedabad.
Right, their case really highlights those classic age-related challenges. Diagnostic tests showed Neha had low ovarian reserve, a common issue, and Arjun had reduced sperm motility. So the specialist created a very tailored plan for them. It involved a milder ovarian stimulation protocol, really aiming for quality over quantity with the eggs retrieved.
Yeah.
And they used ICSI, of course, to help overcome the sperm motility issue.
And despite the odds, despite the previous heartbreaks, on their second IVF cycle, Neha became pregnant. Today, they are, as you can imagine, absolutely thrilled and very busy parents to twin girls. Neha actually shared later that the anxiety about their age, being 39 at the time, was huge. But having Fertilope provide that clear, constant guidance and access to the emotional support services made them feel reassured, like, okay, maybe this window hadn't closed completely for them.
It's a wonderful example of what's possible with the right medical strategy combined with that holistic support. Okay, let's talk realistic numbers, the success rates. It's important to be clear here. For women aged 35 to 37, if their ovarian response is good, the average success rate per IVF cycle is actually pretty strong, often around 45 to 50%.
It's quite encouraging.
It is, but that biological reality of declining egg quality does start to impact things fairly quickly. For ages 38 to 40, the rates tend to be more in the range of 30 to 40%. Once you get into the 41 to 43 age group, success rates per cycle often dip to around 15 to 25%. And honestly, this is often the point where we start having serious conversations about considering donor eggs to significantly improve the chances. For women 44 and older, success rates using their own eggs unfortunately fall below 10% in most cases. Donor programs become highly recommended then.
Understanding that data is so key for managing expectations, isn't it? And for planning, financially and emotionally. This is where Fertilope's insights can be so valuable, helping compare clinic performance for specific age groups, providing realistic probabilities, making sure you're investing in a path that statistically offers the best chance for your situation. And it's vital to talk about those other options when own egg IVF odds are low. If someone is facing severely diminished ovarian reserve, options like using donor eggs, it offers dramatically better outcomes, right?
Oh, absolutely. Donor egg IVF success rates are excellent, often comparable to those of younger women using their own eggs. Similarly, depending on the specific issue, sperm donation or even embryo donation can be incredibly effective routes to parenthood. These options often lead to success much faster than repeated cycles with very low probabilities.
Good to know those options exist and are so effective.
And the technology available now is also improving outcomes. The clinics Fertilope partners with in Ahmedabad offer some really cutting-edge tools that particularly benefit older couples. Things like embryo time-lapse monitoring. It's like watching a video of the embryos developing, helping embryologists pick the very best ones non-invasively. There's also laser-assisted hatching, which can sometimes help the embryo implant in the uterus. And even newer therapies like PRP, platelet-rich plasma, which some studies suggest might help improve the uterine lining's receptivity.
Wow, so there's ongoing innovation making care even more customized and potentially effective.
Definitely. Access to these advanced methods affordably is a big advantage.
Now, successful IVF isn't just about what happens in the clinic. Preparing your body is crucial too, especially over 35. Fertilope really emphasizes lifestyle support.
Yes, we focus on 4 main pillars. First, nutrition. Think supportive foods, protein-rich, lots of antioxidants. Things like spinach, berries, eggs, nuts. These support the energy centers, the mitochondria within the eggs.
Okay, makes sense.
Second, exercise. Keep it gentle. Daily walking is great. Specific fertility yoga can improve blood flow to the pelvic organs without adding stress. Avoid overly intense workouts during treatment.
Right, gentle movement.
Third, sleep. This is fundamental for hormone balance. Aim for a solid 7 to 8 hours of quality sleep per night.
Easier said than done sometimes, but crucial.
Very crucial. And finally, stress management. This brings us back to those emotional tools. Meditation, maybe counseling if needed, and practices like Garb Sanskar can really help manage the psychological load of IVF.
Okay, those are really practical takeaways. Let's switch gears slightly and tackle some of the most frequently asked questions couples over 35 search for online. Ready for a quick Q&A?
Let's do it.
All right, first one. Based on everything we've said, bottom line, is IVF successful after age 35?
Yes. Emphatically yes. With the right specialized care, success rates, especially between 35 and 37, are very good. 45 to 50% per cycle is achievable. Success really depends on that initial ovarian reserve and getting the right clinical protocol.
Good to hear. Question 2. Someone's 41, maybe their tests show low reserve. Should they automatically think about donor eggs?
It should be a serious consideration, yes. If tests confirm low reserve and likely poor egg quality, donor eggs offer significantly better success rates and drastically reduce the miscarriage risk tied to older eggs. It often provides a faster, more predictable path.
Okay. Next, we touched on this, but just to reiterate, how much does the male partner's age really impact IVF success?
It matters quite a bit. While men make sperm longer, the quality does decline. After 40, we see more DNA damage in sperm, and this can compromise the resulting embryo quality and potentially lead to implantation failure or miscarriage. So yes, male age is a factor.
Important reminder. Question 4. How many IVF cycles should a couple over 35 realistically brace themselves for? Everyone hopes for first-time success, but...
While cycle 1 success absolutely happens, realistically, couples in this age group should probably be prepared for the possibility of needing, on average, maybe 2 to 3 cycles to achieve a successful pregnancy. Knowing that helps manage expectations and financial planning.
Okay, average of 2-3. And lastly, can specific supplements or changing my diet actually improve my egg quality at this age?
They can certainly support the health of the eggs you have. Things like CoQ10, omega-3 fatty acids, specific prenatal vitamins with antioxidants. These might help support mitochondrial function, which is like the battery pack for the egg. But crucially, always talk to your fertility doctor before starting any new supplements. Don't just self-prescribe based on internet searches.
Excellent advice. Always consult your doctor. Well, clarity and feeling confident are probably your best allies on this whole journey. If you're looking to explore some of the resources we mentioned, like maybe the book It Starts with the Egg or the Fertility Diet, or finding quality supplements like CoQ10, we've put together links and details in the description below this recording.
And from all of us, especially at Fertilope, we really want you to know that we understand the emotional weight and sometimes the urgency that comes with starting IVF after 35. Our whole commitment is about removing those hurdles, making top-tier fertility care affordable, truly personalized, and as comforting as possible. We help bring together the specialized medical care, the right location, and that vital emotional support you need.
If this conversation was helpful for you and you want more insights like this on your path, please do subscribe to the WombWise podcast wherever you get your podcasts. That way you won't miss future episodes. And definitely head over to the description now. You can explore those recommendations we mentioned and learn more about Fertilope's comprehensive concierge services, see how they might be able to help you directly.
Please join us next week for Episode 7. We'll be tackling the important question: can IVF help with male infertility? We'll dive into specific techniques and success stories related to male factor issues. And finally, If you feel you need immediate, tailored guidance for your own fertility situation, especially navigating the complexities of age or finding the right specialist care, please feel free to contact the Fertilope team directly. Their contact details, including a link to their LinkedIn profile for direct connection, are right there in the episode description.
Just a reminder, as always, this content is for educational purposes only. It's absolutely not a substitute for professional medical advice from a qualified fertility specialist who knows your specific health history. Always consult with them for personalized recommendations. Thank you so much for joining us today on the Womb Lice Podcast.